Chapter, and I'm the director over in the County Health Department. I want to give a snapshot of where we are as a county here, specifically trying to focus on the last 20-day period from August 1st to August 20th. On August 1st, we had 134 total cases of COVID-19 in Overton County. As of yesterday, August 20th, we now stand at 316 total cases. We had 42 total active cases on August 1st, and today we have 166. On August 1st, we were averaging up to that point approximately 3 cases per week for the last few weeks in July. As of these last 3 weeks, we're now sitting at a period of averaging about 9 cases per day. Our community spread rate or positivity rate is sitting at approximately 16% over our last 3 weeks of cases. We had tested approximately 880 people from August 1st to August 16th in the county. That is testing from the health department, hospital, local doctors, physicians, walk-in clinics. The health department had tested approximately 48% of those. 431 were done at the health department. So what you have to realize is we have a wide gamut of healthcare providers out here doing testing. There are a few different tests that are out there now. There's the PRC test that we do at the health department. That's a nasal swab. There's a couple of tests that are quicker turnaround tests as well. But what we're trying to remember is all of this data that is presented, all of these tests, when they are finished, everything is reported to the Department of Health. So we're working with these agencies out here to try to make sure we're on the same page when we get positive cases, and then do contact tracing from there. Issue where I think that we know is out there is schools have started over the last couple of weeks as well in this time period. So really here's our county, Overton County, where we're seeing our numbers go up, our rates go up, and at the same time we're opening schools. We realize that schools need to be open. Schools are an important part of the mental, emotional, physical health of children, teachers, employees, and also parents. So it's imperative that our schools are open. We realize that. What we're trying to do in working with this task force, as well as the school system, is make sure that there's a balance of safety between staying open, providing the services that are needed to the children, and also the welfare of all the citizens of Overton County. So talking about school-aged children, to give you an update of where we are on that, over the last 3 weeks, once again, August 1st to August 20th, we've had 45 cases of children 0 to 20 in that age group. So this is not something we didn't think we would see. I have been saying since day one, we're going to continue to have cases until we have cures, vaccine. And when you have the common denominators of more gatherings, which school is, sports, gatherings, groups of people in close proximity, it lends itself to this virus. That's what the virus thrives on. So we want to make sure that we're trying to address all the plans that are out there from the school system, all governments, county governments, city governments as well. And we're trying to balance the science, CDC directives, Tennessee Department of Health, Tennessee Department of Education directives to make sure that we strive for that safety and we keep things open as we can, as well as looking at the safety, health, and welfare of all the citizens of Overton County. As of right now, we're trying to make sure, as we have basing our decisions on facts, data, science. What I want to stress that when you hear about a case, this person's positive, or this person is isolated, or this person was a contact, I need the public to realize that every case can have different circumstances. Each case can have a different circumstance. Each contact can have different circumstances on how a situation is handled based on who was in proximity to a positive case. We try to look at that situation, analyze the facts, data. We work to then prescribe and work with the local authorities or business or organization, proper medical recommendations and solutions to quarantining and or isolating. So this is not a one-size-fits-all solution. It's not the same situation and case with every single thing that comes up. It's almost like a word problem that you might have if you're in school and a problem solving each time. We want to make sure that we continue to keep businesses, schools, all other organizations safe as they can, and we want things to remain open where we can continue to grow the environment, the economy, but at the same time, we ask that you do your part in the community. I believe that at this point, most people realize that this is a serious situation. We can't stress that enough. We ask that people please follow proper precautions. If we don't follow the proper precautions that we've discussed over this time as far as hand washing, mask, social distancing, we're going to continue having more cases, more contacts, more people that are going to be asked to isolate or quarantine. Eventually, the numbers of positive cases will be that which could deem it necessary to shut down, once again, certain classrooms of schools, part of a school, a full school, a government branch, a business, an organization. We don't want to go there. So we ask that you work with us and please do your part to help us. There's proven science that mask and social distancing and taking proper precautions to protect yourself does help stop the spread and protect yourself the best it can. One way that a person could look at this, and it would be, I've actually told this to some people, it may be prudent to just have the mindset that everyone around you could have COVID-19, and then what you should do for you and your family is to take measures to protect yourself with the realization if we were in a cold and flu season, you would probably try to do the same thing if you knew that there were people that had colds, flu, strep throat, upper GI, stomach problems or issues. You would protect yourself. That is going to be a big thing that you can do that goes into social distancing. That is really one of the best ways to just have a mindset that it's out there. With these numbers I've been talking about, how we've seen this rise, community spread is prevalent. And when I say that, what I mean is we've been able to, in the past, when we've got a case, we've been able to tie down in many instances where that case came from, find out by doing contact tracing, by doing investigation, where it originated, how it spread. We're seeing more and more now with the influx of cases. We're also hearing people say, I don't know where I got that. I've not been around anyone with COVID. I've been protecting myself. We don't know. So the thing that we're seeing, and this is the troubling aspect. When community spread, it's prevalent, where it's out there now more and more, where you can just pick it up and not know how. That's where it gets harder to target it and then fight it. I want to reiterate that the health department, Overton County Health Department, we're testing every day from 9 to 12, Monday through Friday. The COVID test is free. stay in your car. We're getting turnaround time. It can be anywhere from 3 to 5 days. Sometimes it has been a little bit quicker. But the turnaround time in our work with the lab has gotten better. We encourage everyone who wants a test, or if they feel like they've been in contact, or if they need a test, to get tested by the health department or any of the private physicians or hospital here in the area. Any further questions, we can be reached at the health department at 823-6260. Thank you for your time. I'll be happy to answer any questions now or later. Thank you.
Hey, thank you. I just wanted to go over a few things. Number one, just some reminders that Amy talked about we're recommending you to wear a mask, to social distance, and hand hygiene like we have been. And something I wanted to speak about the mask. There's a lot of people out there that feel like the mask is a hoax or something like that. So I want you to think about if you were to get ready to go into surgery and none of the nurses and the doctors didn't have a mask on, you would feel like maybe that's not as a clean environment as it needs to be. When you go in there and that room looks prepped the way it needs to be, and those nurses have their hair up in the nets and they have their mask on, you have that sense of security that that is a safe, clean area. Or if you were to go to the dentist office to get your teeth cleaned and somebody was in your face and didn't have their mask on, you would feel that you would feel like it was not as clean. So that's something I want you to think about out in everyday life, that used to, this was not something we had to do and didn't have to think about, but we know this virus is out there. We know it's spread by droplets. The hospital is used for years. If you have somebody that's on droplet precautions, the nurses wear a mask. This is a science that we have used for years, and it works, and we know it works. So the whole thing with the mask is it does protect you some, but it protects those others as well too. So we're depending on each other as a community to protect each other, okay? So let's not just think about ourselves at this time. Let's all work together to help protect everybody. So that's just something I want you, it's just some food for thought. And then the social distancing, things to think about, but we still recommend that, if one person can do the grocery shopping or do errands, things like that, it's better to not take the whole family in. And I think as the economy opened back up, we kind of forgot that, and we thought, oh, everything's open for business, let's go back. Yes, we still want our economy going and thriving, but we can still spend our money locally with one person in the household going and doing that sort of thing. Because we know with the kids, we tend to spread more germs, things like that. If you can get in and get what you need and get back out, to try to think about things like that. And again, washing your hands, trying to remember not to touch your face. I think people are getting better at that, but just be conscious of that. If you're going to touch anywhere on your face, make sure you wash your hands first, or touching your food, anything like that. And for parents with children of school age, just reminding your kids each night, trying not to share their school supplies at this time. This is a year where we need our own set of supplies, and we need to continue to use our own pencil and our own eraser. And I know they've gotten water bottles and things like that for each individual child. So that's a really good thing, but just reminding your kids, because they forget things, especially when they're little. And personal items, we don't need to be sharing any sort of personal items at school too. And then I also wanted to talk about, there's been some new guidance on quarantine times. Now, I've dealt a lot with that, the schools, because that's really hit home, but I thought I would let the general public know as well. And what's changed is the household contact times. So when we were saying 14 days from date of last exposure, well, a lot of people were calculating, say if you've got a husband that's positive and you've got a wife that lives with that husband, so his 10 days starts because he's positive of his isolation time. Well, she's got to quarantine for 14 days of last exposure, from the date of last exposure. Well, she lives in the household with him. Technically, her date of last exposure is not until the end of his 10 days, because he is considered potentially infectious for those entire 10 days until they're released from isolation. So that's something that was kind of getting missed, falling through the cracks, and the state realized that, and we updated some guidance, and we're trying to give education. So that's something that people may be hearing now that they weren't used to hearing before. So we just wanted to explain what that was. Now, if you've got somebody that, it's a separate apartment, or it's another house on the property, like that, where they're not actually in contact, then your date of last contact, it's still the 14 days, that hadn't changed. Or say maybe you ate lunch with somebody on a Wednesday and found out they were positive, so that was the last contact you had with them. It's still the basic 14 days. What it's really affecting is when you live in the household and share bedrooms or bathrooms in the kitchen and that sort of stuff that's unavoidable, your contact's going to continue to happen. So that's not going to start until the end of their isolation, okay? So that's just a few things I want to let you all know, and thank you for your time.
Thank you, Megan. Thank you, Andy, and thank you, Megan, for that update from the health department. And also a reminder, Megan, I'll agree, sometimes we forget about the social distance. And I do have a question. So that 14-day has now turned into 24 days, is that correct?
Yes, potentially for the household contacts, because they can be exposed for up to those 10 days. And if the patient that is positive, if they become symptomatic and stay symptomatic past that 10 days, it actually pushes it out even further. So you might have somebody in quarantine like 31 days or something like that.
Wow, thank you. Next on our agenda is Mr. David Cox, Livingston Regional Hospital. Thank you.
Hello, and thank you very much for allowing us to be a part of this press conference. Appreciate that very much. 150 days ago, we postponed elective surgery cases in our hospital with the COVID coming into our community. But since then, we have returned back to our normal surgery practices. Orthopedic cases have now returned to Livingston Regional Hospital and have for a little bit. We're once again doing hip replacements and knee replacements with our orthopedic team. Non-elective surgeries for general surgery are also returned to the hospital. There is a new pre-op checklist, if you will, for our patients that are coming in to have surgery. That would include a COVID test. So please consult with your doctor, and we'll be happy to help you through that so that people can get the much needed medical care that they have been putting off. We have incorporated several new procedures for our staff and patients to continue to improve our safety within our hospital. The most recent, last week, we incorporated a new employee temp check station. And basically what that is, it's a small screen that we're able to walk up to, and it takes your temperature and gives you a readout and allows you to move through the line. This is for employees only. For visitors and for our patients, we still have a upfront screener, and that's an actual person that you can talk to that will actually take your temperature for you, ask you the questions that they need to have for the screening, and also be able to help direct you. So still, you're not looking at a computer screen, you're being helped by an actual person. We are taking care of COVID positive patients in our hospital, as many other hospitals are, but we are glad to be here to help them through this time and to get them on the road to recovery. We have a special isolated COVID unit in our hospital. We are by no means overwhelmed with COVID. I did have someone ask the other day, are you just over flooded? No, we're not. But those patients that do come into the emergency room, you will be directed and be cared for by our emergency medicine team. And if you do feel like you have emergent need, please don't put that off. Please come in. Our hospital is safer than ever because of the standards that we've put in place to help with our community. We've also welcomed back our visitors. I call it the 1-1-1 plan, but basically the plan is for every patient that we have in the hospital, they're allowed one visitor for 1 day, and every day is a new day, obviously. So if you have one visitor come in that day and see you for an hour, that was your one visitor for the day. And our attempts there is to cut down on the amount of cross-contamination or just foot traffic through the hospital. And they also will need to bring a mask with them so that we can conserve our PPE levels to an adequate standard. We appreciate our hospitalist team and the nurses that are taking care of our patients, whether that's a COVID positive patient or not. They've been doing a great job during this time, and we appreciate everything that they're doing. Thank you again, and we look forward to continuing to serve this community. If you feel like you are having issues and you need our help or in need of some emergent care, please don't put that off. We're more than happy to help you. We are safer than ever and here to make our communities healthier. Thank you so much for allowing us to be here again.
Thank you, David. Any questions for Mr. Cox? Okay, thank you. So next, we will have Mr. Scott Stevens, Overton County Health and Rehab.
Thank you, Mayor Hayes, and good morning, I guess, everybody. Thanks for having us here. Overton County Health and Rehab, we have a lot of people asking about visitation. We're just a little bit different than the hospital. We're not allowing in-building visitation, but if you would like to set up an appointment to visit your loved ones, immediate family, I would like to say, immediate family set up an appointment. There's two options you have. First of all, we have window visits. We have some designated areas in our building where we can bring your loved one to that window, and you would be outside the building with a closed window, and we will open up communication with the telephone so that you'll be able to talk via telephone but see each other. So that requires you to call ahead so that we can schedule it. Don't just show up and say you'd like to visit. We need this to be organized in a manner that doesn't interrupt our schedules. So all you have to do is call us at 823-6403, 931-823-6403, and let us know you would like to set up a window visit. The other way that you can visit has been going on the entire time, and that's with technology. So if you would like to do a video visit using one of the technology apps, again, call the same number, 931-823-6403, and we'll make that happen for you. Our residents are doing really well, and yesterday we had somebody donate a truckload of fresh watermelon from their garden, so the residents really enjoyed that. And I just want to remind everybody that's out here that would like to feel like they're contributing to the seniors at the Overton County Health and Rehab. One way you can do that is if you got a garden and it's got a lot of surplus, you can drop off some garden items, and it brings back a lot of great memories for our residents when they had a garden. Another way is flowers and cards. So if you have some fresh cut flowers that maybe out in your garden you'd like to bring, some people just put them in a little Dixie cup with water and drop them off, and we'll get them out to all the residents. We ask everybody to please continue to keep us in your thoughts and prayers, and thank you for your time. Any questions?
Thank you, Scott. Job well done there. So next we have is Ms. Shannon Cantrell from Overton County Chamber of Commerce. Shannon.
First of all, I want to start with something we've tried to avoid, but unfortunately at this point, with the COVID numbers continuing to grow like they are, we really feel like it's in the best interest of the community at this point to cancel Halloween for this year. The health and safety of our children and our citizens are of the utmost priority, and policing an event such as this size is just going to be too risky. So as bad as we hated to have to do it, we see that it's just a necessity at this point. So we can promise you that next year, following will be better than ever. So hopefully, I'm actually trying to plan something a little smaller that will include a movie at the park. We'll talk about that later. It's not completely devised yet, but we'll get there. Some updates on unemployment and sales tax numbers. Our unemployment is consistently dropping every month, back down to some normal areas. Currently, our June number is 7.4%. We should have our July numbers next week, and I should be able to report on those on our next press conference. Local sales tax numbers continue to show an increase. We are up 21.9% from last July. We're up 20% for the quarter, and up 12.1% yearly. So those are definitely some positive numbers. I do want to report that the Small Business Development Center was with us at the chamber yesterday, and a number of our small businesses had the opportunity to meet with them. This was a great opportunity for them. The Small Business Development Center has a number of free resources that are available to you and your business, whether you're an existing business or whether you're a new startup business. I would definitely encourage any of you to contact them and set up a free consultation. Everything with the SBDC is totally free to you and your business, so it's worth making the effort. To sign up for an appointment, go to tsbdc.org, choose Advising Services, and then choose Sign Me Up. This is a little bit of information that I just happened to come across this morning that I thought everyone would like to know. During the pandemic, there's been a lot of people who have made the choice to vacation closer to home. And it was worth mentioning that all Tennessee state parks are offering a 10% discount to any Tennessee resident if they're coming to visit their state park. You would need to go to reserve.tnstateparks.com to take advantage of that discount. Okay, in the city of Livingston, through the Main Street program, we have applied to become a Smart Start community. This is another thing that will help our local businesses recover from some of the COVID issues that they have had. It will enable our businesses within the downtown district to have the most up-to-date tools and resources available to them. We will have more information on this hopefully very soon. And lastly, the Tennessee Small Business Relief Program has added an additional $83.5 million. And this expansion includes additional businesses that weren't included in the first round, provided that they have less than $10 million in annual gross sales and fall within the industries impacted by executive order limitations on activities, gatherings, and other non-essential businesses. For a list of those additional businesses that were added, you can go to tn.gov/governor-news. And just in conclusion, I just want to let everybody know that your chamber is here to help you guys as far as any business needs that you have. Give us a call and we can discuss all of the resources that we have at the chamber for you and your business. Thank y'all.
Thank you, Shannon. Thank you. Next is our Overton County Executive, Mr. Ben Banner.
Thank you, Mayor. To put the numbers in perspective that Andy talked about, 1st of August, we were 80th out of 95 counties in the number of cases that are active. We were 52nd yesterday out of 95 counties. I just want everybody to remember, don't let your guard down. This thing is nowhere near over. I know everyone thinks the day after the election it's over with and they may stop reporting numbers like they are maybe after that, but I don't think the virus itself is going away. The longer it goes on, I think people probably are tired of hearing about it and thinking about it, and everybody's kind of trying to put it behind them and just go do like we used to do, but I promise you we're not to that point yet where we can do that. Just think of not only yourself and your kids, but your parents and grandparents. I worry about the kids, and most of them probably, if they do have it, will probably be all right with it by the numbers, what they're showing, but if they give it to parents and grandparents, who knows how they, because most of us have probably been around somebody that had it. Like Andy said, we need to act like everybody's got it, whether they've got it or not. But if they don't have symptoms, who knows? They don't even, a lot of people that I've talked to that were having a procedure at the hospital and they got tested, and that's the only way they know they had it, because they had to get tested before they had that surgery. So, none of us knows, and anybody next to us could have it, or anybody at our house. So I just like to ask everybody not to let your guard down. And I know everybody wants to get back to the way things were, and I think we're a long time from that, and who knows what the new normal will be, but just like I say that, just remember that, it's not over, and just treat everybody like Andy said, like they've got it, and protect yourself and your family. So that's all I've got right now.
as far as the city is concerned, we ask that anyone that comes and does business here at Livingston City Hall to please wear your mask. We have masks outside the front door that obviously at no cost, free for you to have, but we do ask for the protection of our employees and for your protection as well. As we've heard the health professionals say today that masks will certainly slow down the spread of COVID-19. So we ask you to do that. I've asked all city employees to be wearing masks while they're out working. So again, as County Executive Ben Danner, I want to stand alongside of him and saying, please, please, please wear your mask. Please. We think that if we're ever going to get back to any sense of normalcy at all, that it is going to be important that everybody does their part. It's not just me to do my part and the other one don't do their part, but for everyone to do their part so we can try to get some normalcy back to life. And I truly believe that's what everybody wants. So it's going to take all of us to get that done. So I want to thank the panel today for coming out. Thank you so much. I think this is so important. And Ben, thank you that our community stays updated on the events, especially with COVID-19. I do have a question before we leave. And it's really a school system question, but maybe you can answer it. I know that ball games are coming up at Livingston Academy. Is there any special precautions that are going to be took at LA, or is it just if you feel you can answer that, maybe you can. I don't know if that's been discussed.
It's my understanding that football games that are coming up will be followed under the guidelines of TWSWA, the counties, Overton County, Livingston Academy, and they have, you're looking at a 1/3 to 1/4 size of attendance based on the population of what can be in the stadium. That's one of their requirements. They're also asking that people wear a mask. I saw last night where on the news, some football games that were played last night, people were required to have a mask going in and wearing it. Also, temperature checks are happening in some places. The guidance of this comes from Department of Education along with TWSWA. So, fewer people, social distancing in the stands, kind of like what we try to do with graduation. Family units sitting together. Those are some of the things that I think they're looking at. Fewer people down on the field. We have not been heavily involved in those directives. They have come specifically from TWSWA. We support those. We do know that at least on the football games, these are outside. That's a better situation than being inside in a closed, ventilated area. But for more information on that, I'm sure that local school system will have more direction on how they're going to deal with that in the future.
Okay, thank you. Thank you very much. Andy, hate to put you on the spot like that, but I just know that we've got games coming up. I know there was one in Putnam County last night, big row right now. I didn't get to make it, didn't know what procedures that they used last night. So folks, we will have another press conference on September the 11th. That will be here at 12 noon. And again, I just want to thank everybody for coming out and participating. I still believe that our community strongly needs this information. So thank everyone. Job well done, and we are adjourned. Thank you.